Hello, this is Dan for the Healthy Nurse, Healthy Nation initiative. I chose my target population as my fellow peers at Elliott Hospital, my fellow nurses. One of the 5 areas for my presentation will address physical activity for nurses. Majority of nurses in the healthcare field unfortunately do not get enough physical activity, so my goal is to start a step challenge at my workplace at the Elliott in Manchester to help increase quality of life, quality of care, and promote general wellness for my fellow nurses. So the strategy is to set up a 10,000 step a day step challenge to hopefully encourage people to meet the minimum 150 minutes of moderate exercise per week. The benefits to people that participate in the challenge will be to promote rest, increase their credibility at the workplace, decrease chances of chronic disease, boost self-esteem, and also reduce anxiety, depression, and burnout because we do work in a very stressful environment. So the first big benefit of consistent exercise and doing the 10K a day challenge would be increasing depth and duration of sleep, more restorative sleep while you do get sleep, and low intensity exercise is actually the best type of exercise to promote sleep, especially if you do it close to the time that you're going to sleep. That also helps you kind of tire yourself out and shut off those wandering thoughts before going to bed after a long, stressful day. Another benefit would be that's been found in some of the journal articles that I found would be that nurses typically do see some increase in their credibility, especially while doing teaching. So it shows that you also follow your own health advice that you're trying to get the patient to follow. So it increases the effectiveness of teaching and the patient's reception of it. So it's a show, don't tell type of model that you would also reinforce what you're doing by showing them that it can show benefits. Obviously, getting activity does boost your physical health, decreases your chance of cardiovascular disease, lowers your chance of diabetes, increases your stress tolerance at work and at home, increases your aerobic capacity. That way you can keep up with the challenges of every day and in general be in better shape. And then it also slows cognitive decline as you age. One of the big benefits of doing the 10K a day challenge would be to enhance your subjective well-being. So generally, when people would rate themselves on how they're feeling, they would feel better about themselves, and it would also improve your physical self-worth because you would show that you can follow through on a goal, which 10,000 steps a day would be a good goal. Consistently doing this would also help reduce a lot of mental health issues that a lot of healthcare workers do unfortunately suffer from because we are always in a time crunch, always in a high pressure situation throughout various hours, working nights, holidays, weekends, etc. So it helps release some endorphins, regulates your stress hormones, and then it can also, even if you're doing well, prevent future issues with mental health you might have. To promote the plan, I'd make the process have some sort of a prize at the end and a low fee to fund it. So let's say if you have a large organization, you can have participants pay $5. If you have 1,000, that's $5,000. You can have some really nice prizes at the end. You could track people participation and tie it to a tiered prize list. And then to assess the success, you'd make a survey about how people are feeling, their sleep, how receptive patients art of teaching, maybe do some baseline vitals, make it almost like a health clinic, and then repeat the process post-challenge while keeping it anonymous. We could also keep everybody honest by having them use a pedometer. If they don't have one, we could also simply use their cell phone. They all have them built in. I would expect to see a general increase in well-being for my fellow peers. I would expect them to feel better about themselves, be able to keep up with the workload a little better, and then also have a better work-life balance so they wouldn't be as tired or stressed after their shifts. Thank you so much.